that was purchasing cleaning supplies to sanitize and clean schools. And then the third most important fund, as stated in our community, was to coordinate emergency response, working with our local responders and for items and that are needed for our schools. So we really appreciate that. It lets us know that of these 15 pots in our plan, we will prioritize Fund 1, which is any activities authorized under ESSA, IDEA, Adult Education, and Career and Technical Education, coordinating with our emergency response, and then cleaning supplies to sanitize and clean our schools. So again, wanted to share that your feedback on these surveys are appreciated, valued, and added to the plan. If you look at what the respondents said, over 1,200 people looking at what we could do to address learning loss. There's a lot of our children, our students who are out of school, who are faced due to whether it's quarantining or whether it's dealing with being out of school for summer. We see that there is learning loss, and we saw very clearly 57.9% believe that tutoring is the way in which we should prioritize addressing that learning loss. So we looked at tutoring, summer enrichment, and extended year. So these are some of the items we felt that we will prioritize in our plan to help address the learning loss. And so we will take this feedback, and we will ask that if you have any questions about the ESSA 3 funds, please hold those questions until we conclude with Dr. Kelly's presentation, and that way we will address our reentry guidelines as well as the ESSA 3 fund guidelines. So with that, let's talk about back to school. Of course, 17,000 students will return to school in School District 5 of Lexington and Richland counties next week on the 18th of August, and we're excited. We are getting ready. Teachers are planning and working really hard to ensure that we're ready for your children. As a result, as a community, we felt that it was important to have common language about how we would operate given the COVID guidance that was released by the DHEC. What we created was levels of mitigation. We believe, just as the medical evidence suggests, that we should layer our interventions. And so we wanted to communicate with this five-level process, just what's going on in the schools and how they're operating. Previous to the pandemic, all we had was the language of school is open or school is closed. And I wanted to communicate to parents just what's going on in the schools, how are we operating, how school operations change. And so you see level 1, this is pre-COVID. We're open with no mitigation. And then level 2, we start to, you can see that there is some mitigation, but it's low. And things are still moving. And as community spread and number of cases increase, you see the level of mitigation increases. And level 5, our buildings are closed and we move to distance learning. All this information is available on our website for your review at www.lexrich5.org/COVID-19. And you can see that. So what does it mean? It means that we're looking at this mitigation matrix. This is version 2 of this. And when I say version 2, that lets you know that your feedback and information that we get tonight helps drive our work. As a principal, I took so much comfort in going to a emergency handbook anytime there was a storm. And in that storm, I could just read with comfort the information that was there, the items that I needed to say to my staff, and what I needed to say to the students and parents. We did not have that for a pandemic. This is an opportunity to try to create that by coming up with levels to help schools, help communities plan as we see the community spread and positivity rates increase or decrease within our schools and community. So what this version 2 matrix does, it lets you know how we will operate when community or county spread is low and the number of positive cases are low, then we'll operate on level green. And as county spread and cases continue, excuse me, we operate on yellow. And you see when items are high, like the county spread rates are high, or the positive cases are high, then we operate on orange. So right now, we would be at a level orange if we opened up today. And so this gives us that information. Now, red and closing schools, that's under, that call will be made by the superintendent, or unless there's a order from the governor that supersedes the superintendent. But this gives you an idea of how we will determine what level that we are on. We believe that there's so much that we can do to drive our schools down to the green. And we're looking at these mitigation guidelines based on the South Carolina Department of Health and Environmental Control. We received some guidance from operating our K-12 schools, and we were very appreciative. And what you'll notice is that there are 9 levels of mitigation, 9 things that we can do to help. Vaccination and mask use are 2 of those, but physical distancing and contact tracing. Understanding who's sick by getting tested and staying home and quarantining when you're sick. The screenings that we can do, ventilation, and I think some of the biggest things after disinfecting and cleaning is washing our hands and using respiratory etiquette. So there are a lot of things that we can do to address the transmission levels so that we can move our schools into green and eventually to blue. You can find our layered levels of guidance again on our COVID-19 resources page, which is located at www.lexridge5.org/COVID-19. And you'll see everything that we have from how we operate under level blue, levels green, yellow, orange, and we're praying that we don't go to red. Even though we're open up in orange, we expect to see the numbers of positive cases rise, as we see with some school districts that have opened up already. But you will see on that website all of the things that we're doing in the schools to reduce that level of transmission through our high mitigation protocols. Our teachers are reviewing this currently. Our principals have had this information and have given input from everything of how we move through the halls and what we do in the cafeteria and classrooms. So we're very proud that we're working on this. While this is not a perfect document, it's a document that we are using to improve. And so I believe the power is in the pivot, and we will keep learning and taking your questions and your feedback to help us make this the best. I believe that as our students come back, they have to feel that there's some sense of control of their environment. They have to feel that the stress and the anxiety that builds from not knowing or from being scared, that we can address that. You cannot learn under stress. And so we are providing these operation guidelines so that our kids can calm, that our teachers can be empowered, and that our students can learn. So we want to thank you so much for listening to our presentation today. And with that, I want to turn it over to Dr. Jane Kelly so that she can give you an update on behalf of the CDC. So I'm sorry, on behalf of South Carolina DHEC. So with that, Dr. Kelly.
Well, thank you very much. And actually, I used to work at CDC until I moved to the great state of South Carolina. So your comment was not that far off.
All right. Well, thank you for bailing me out on that.
Well, what I'm going to focus on predominantly tonight is on vaccine, because that's where I think there are a lot of misconceptions, and hopefully I can debunk some myths. But before I do that, I do want to give you a little bit of background information, sort of what is the state of the state with regards to community transmission. And unfortunately, right now, everywhere in the country, there is high community transmission. And if you look especially at the southern states and where does South Carolina fit in, we are among the top 11 in terms of all the states in terms of level of community transmission. You read a lot in the newspaper about Louisiana, Florida, Arkansas, what's going on in those places. And they're at the top of this chart, showing 7-day case rate per 100,000. Louisiana is now even higher than this. I took this from August 8th. Louisiana has one of the highest case rates anywhere in the world that we know of. But South Carolina, unfortunately, is pretty high as well, including with that percent positivity, meaning of the tests that we do, how many of them are positive, what percentage of them are positive. Are we finding more cases because we're just doing a lot more tests? We are doing more tests, but that percent positivity indicates there's a lot more COVID out there, probably a lot that we're not finding yet, that we're not identifying yet. And I know the governor recently made a statement about, this July is really no worse than it was last July. And he was looking at deaths, the number of people who have died from COVID. And that is true. Back last year, this July last year, we were seeing more in the way of deaths because we didn't have a vaccine. We had people in nursing homes, elderly people dying from COVID-19. Thankfully, we are not having that big a surge in deaths, but this slide shows you the surge in just sheer numbers of new cases. And we've not seen this many new daily infections since January of 2021, when we didn't have a vaccine. Everywhere in the state right now has a high 2-week cumulative incidence rate. That's one of those measures that CDC was recommending that a community use and trying to decide kind of what level of mitigations to adopt in schools. So that's true throughout the state. A little bit of data on who's vaccinated. This is as of a few days ago. I think the total percentage of South Carolinians now is at 45.4% of those age 12 and above are fully vaccinated. And by that, I mean at least 2 weeks after their final dose of vaccine. For the teenage group, 12 to 19, about 26% of that age group are vaccinated. We don't have a vaccine yet for those kids under age 12. And the best approach for keeping them safe are those mitigation measures and also vaccinating around them. Vaccination is how we get out of this pandemic. But I know there are a lot of misconceptions and absolute myths around vaccine and about COVID-19. So I want to address a few of them. This is one, that this myth that most new infections are among the vaccinated. I'll show you why that's not true. I've heard a myth that why are we so worried about COVID when 99.7% of people survive? That's a myth. I've also heard people say that vaccination is more dangerous than COVID disease itself. Let me show you some data to counter that. Also heard people say, well, if I had COVID already, I had this infection before, so I'm covered. I don't need vaccine. Vaccine will strengthen your immunity, and I'll show you some data on that. I also want to talk about this vicious rumor about vaccine affecting fertility and the myth that kids don't get sick. So I'm going to do a little bit of a Mythbusters here. This is a complicated slide. I want you to focus on where I have circled it in red, that the vast majority of infections in South Carolina are among those without vaccination or without prior infection. Prior infection does give you some immunity. This is from a study at the Medical University of South Carolina in Charleston. But this is true for the data that we have in the state and in the country. Far and away, most of the infections that we are seeing are among people who are not fully vaccinated. nationwide, more than 97% of the people who are hospitalized and more than 99.9% of the people who die from COVID-19 are among those who are not vaccinated. Now, what about that survival rate? Where does that 99.7% number come from? I'm not sure. I think that there's some assumptions about, we know that there are some people out there who don't get tested. Maybe they don't have symptoms and they don't realize they had COVID. So when we talk about there being more than 35 million cases in the United States, that's under that confirmed column, there are probably more than that. But in order to get to a survival rate of 99.7, well, let's do some arithmetic. We know that there have been over 600,000 deaths from COVID-19 in the United States. That's a case fatality rate of 1.7%. That means, of those 35 million people, 600,000 died. That means 1.7% of them died. In order for it to only be 0.3%, if 600,000 confirmed deaths were only 0.3% of everybody who was infected, then we'd have to have 200 million Americans infected. I don't think that's true. I don't believe that we have had that many people infected. So that survival rate of 99.7 is a myth. What about vaccination is more dangerous than COVID? Again, let me give you the data.
When do we know? Oh, because
we know COVID. We know that COVID deaths, 616, 493. And we know that there have been over 350 million doses of COVID-19 vaccines given in the United States since they first became available in December 2020. There have been about 1 to 5 severe allergic reactions per million doses, depending upon which vaccine. And there have been 28 cases of that rare disorder with blood clots and low platelet count that was associated with the Janssen vaccine. But I imagine the parents who are listening tonight are thinking about myocarditis and Pfizer vaccine. What is the deal with that? This is a very busy table, but I just want to show you where the data comes from. They looked at looked at COVID vaccines, how many millions of doses were given by age group, and they split it out as male and female because it was the younger males. In fact, it's the young males ages 12 to 17 that had the highest level of myocarditis cases. Myocarditis is an inflammation of the heart muscle. So you can see in this chart, it says 56 to 69 per million doses of vaccine. But I know that's hard for me to wrap my head around when we start talking about millions of doses. I know that the American Heart Association, the American Academy of Pediatrics, and CDC all agree that the benefit of vaccine greatly outweighs the risk of myocarditis. But let me try and put it in numbers that maybe visually you can see a little bit better. Imagine the football stadium of about 80,000 boys, all aged 12 through 17, and they're all vaccinated. 5 to 6 of them would experience myocarditis. Almost all of the cases, 95% of the cases in the United States that have been investigated have been mild and in fact have now completely resolved. So 80,000 all vaccinated, 5 to 6 who experience myocarditis. Let's turn it around and imagine another stadium, 80,000 boys aged 12 through 17, not vaccinated. On average, over the next 3 months, 456 of them would get COVID. 18 of them would be hospitalized. 5 of them would require intensive care unit care, and 0.2 deaths would occur. Now, I know that's less than 1 death, but that's not 0 deaths. Kids certainly are much more resilient in fighting off COVID. They're much more likely to have mild disease and not have serious disease, but that number still is not 0. All right, what about prior infection? If you had an infection before, you've primed your immune system. You've made some antibodies, you've revved up your immune response. Do you have any benefit for getting vaccine? This was a study that was published just last week, August 6th. What they did was they compared people in Kentucky who had been infected with the SARS-CoV-2 virus in May, June of 2020, and then reinfected May and June of 2021. And they compared them to people who didn't get reinfected in May and June 2021. And the reason they chose those time periods is they wanted to make sure that they matched them up with what people are doing, that they chose the same time of year so that you'd have the same factors of, whether people are more likely to be outdoors than indoors, that sort of thing. What they found is that the unvaccinated people who had prior COVID, but they were unvaccinated, they were more than twice as likely to get reinfected than the people who had prior infection but then also got vaccinated. So vaccination does improve protection for people previously infected. I do want to emphasize that this study was done before Delta was the predominant variant. We have a lot of concern that we know Delta spreads more quickly, but also there is some evidence that infection with it from a different variant, the antibodies that you make with a different variant will not protect you as well against Delta. But they engineered these vaccines to protect you, give you a stronger level of protection. And there is good evidence that vaccine will protect you against the Delta variant. What about fertility? Now, of course, during the Pfizer vaccine studies, for example, they didn't deliberately enroll any woman who was pregnant. They excluded pregnant women from studies. That's routine. They do that with other vaccine studies and other medication studies. But I will say that 23 women did become pregnant during the study, and the only one who had a pregnancy loss was an unfortunate woman in the placebo group. So that's a little bit of evidence, but we have much more evidence, and I'll show to you in a minute about that vaccines do not affect fertility. But first, I'd just like to talk a little bit about where did this fertility rumor begin? In December 2020, just as FDA in this country was approving vaccines, the European equivalent of the FDA was looking at approving the Pfizer vaccines. A physician and an ex-Pfizer employee wrote a letter to them. And I have a copy of that letter. If anybody wants it, I can send it to you after this presentation. But it's like 70 pages long. 17 pages long. Among the claims in that letter is a claim that the spike protein, that all of our vaccines rely on making antibodies to the spike protein. The spike protein was similar in structure to a placenta protein, and that therefore vaccine will cause a woman to make antibodies to the placenta. There's no evidence that this is true, but I want to tell you a couple of other things that they claimed in that letter. In that same letter, they made other claims. I chose two just to show you how outrageous some of the claims that they made. They made a claim that 70% of people would have severe allergic reactions, that because the Pfizer vaccine has polyethylene glycol and so many people are allergic to it. Well, that has not happened. We have had 1 to 5 per million doses of vaccine allergic reactions, but nothing anywhere near 70% of people having allergic reactions. The other thing that they claimed is that the vaccine has this glow-in-the-dark ingredient. And this is simply not true. The vaccine does not glow in the dark. Early studies, when they were studying the vaccine in tissue culture, in the test tubes, they were using this bioluminescent thing so they could see where the antibodies were attaching to the virus, but certainly not in the vaccine. So they've made some really outrageous claims. Here's my evidence against vaccine affecting fertility. If the COVID vaccine affected the placenta, you would expect more miscarriages. This slide is from a study of over 35,000 women who were pregnant and vaccinated. And this table is taken from a study in the New England Journal of Medicine, probably the most prestigious medical journal in the United States. And what it's comparing are all these different outcomes of pregnancy. So for example, one of them says spontaneous abortion. That's the medical term for a miscarriage. It's not an abortion, it's a miscarriage. And they looked at what do we know in general about women having miscarriages? That's that middle column saying what's the incidence, how often does it occur? And what did we find in our registry of 35,000 women who were pregnant and got vaccinated? And they found there was no increase in miscarriage, no increase in stillbirth, premature birth, small babies, birth defects, newborn deaths. But let me show you yet another one. There was another study, and I've got the link on the bottom in case anybody wants to look for themselves. We have many years of data on miscarriages by the mother's age and by what week of pregnancy she miscarried. And in rich countries like the United States, there's a range, about 11 to 16% of pregnancies end in miscarriage. In this study, with over 2,000 pregnant women who got an mRNA vaccine, that's either Pfizer or Moderna, before they got pregnant, or right before they got pregnant, or within that first 20 weeks of pregnancy, the risk of miscarriage was 12.8%. It's right in that same range. There's no evidence for an increase in miscarriage. What about kids don't get sick? Well, it is true, the older you get, the higher your risk of severe illness. But in the United States, more than 4 million children have been infected with COVID-19, more than 15,000 hospitalized, more than 4,000 had multi-inflammatory syndrome of children, which is a serious illness, and more than 300 have died. It varies by race, ethnicity, probably for a bunch of different social factors or maybe some other comorbid factors, but it's not zero. It's the number of deaths is not zero. One other concern is even if your child has only mild symptoms, it is possible for them to develop long-lasting symptoms. This is just a screenshot of a website, Long COVID Kids and Friends. This is not, let me finish and I'll be glad to answer questions. Long COVID can affect people who even have just mild disease. So just for awareness, this is not a government website. This is put together by people who are families who are experiencing this. And lastly, I think you're probably already aware of what's going on in Kershaw County. We can put aside talks about severity of illness. Let's just talk about how this is affecting kids because they have to quarantine. In Kershaw County, over 100 kids tested positive. And what that meant was over 500 kids are out of school. They're at home quarantined because of that exposure. So, we all know, we all want kids to be able to return to in-person schooling. The concern about this rapid spread is not just severe disease, it's also kids are going to be out of school. But I'll tell you, at the bottom of this slide, something I literally just copied this from an email I got from an MUSC physician at Children's Hospital. And she wrote, we had a 16-year-old die of acute COVID here this morning from Kershaw. Have another very sick 12-year-old on the way. So I think the big take-home message are these new variants, especially Delta, spread much more easily, and the vaccine will work against variants. Every time we talk about any decision in life, we have to talk about weighing the benefits and the risks. The benefits are the vaccines are highly effective. The risks for COVID-19 disease for serious illness are lower in children, but it's not zero. And there are some long-term effects. I'm going to leave this up for a moment so that if anybody wants to write down my email address, I would be happy to field questions that we don't cover tonight by email as well. Thank you.
Thank you so much, Dr. Kelly. We really appreciate that. And this gives us some time for questions and answers, and so that we're able to get as many questions in. We want to thank everyone that has joined on today, and I want to thank our team, but Laura McElveen will be monitoring the chat room. We hope that we can get some questions. We know that there's going to be comments, but this is an opportunity while we have our staff here, while we have Beth Poore and Dr. Jane Kelly here from South Carolina DHEC and my staff here, we can talk about if there's questions on ESSER, questions on COVID operation guidelines in District 5, or questions about Dr. Kelly's presentation. This is an opportunity as a forum to hear from you. So I'm going to ask that you put those questions into the chat, and you can start loading those in, and we'll take them one at a time. But this makes sure that the questions are addressed and not the commentary, which would take away from a lot of the a lot of the time we have to get information out.
All right.
So with that, Laura?
Yep, I've got the first one. Kindergarten has no remote option. If schools are red and shut down, will that start a remote option?
And that's a great question. Of course, we would have to look at what we would do in terms of addressing those kindergartners, those 4K and even 3K students who do not have those devices. We're currently working K through 12 on our remote learning and our quarantine platform. There is no secret that being in person, being at school is the best instructional strategy. So our entire instructional team is looking at better ways to ensure that we don't have this learning loss or degraded instructional delivery from pre-K through 12.
All right, next question. Since our students are returning to school under level orange, have any considerations listed in this level high risk sports, abbreviated school day, optional screening been addressed or discussed? If so, which ones is the first part? And then the second part of that question, if not, then why?
Good question. So what we're going to do is we're going to open up and stay at that level for at least a week. This gives our team an opportunity to respond. We believe that it was best, even though we have not received or not started our dashboard, we know from what we're seeing in places like Kershaw that there will be a rise of cases. Some of those are already being reported now. It is out of abundance of caution to open up on orange. So have we considered lessening the school day? No, that's just another strategy that we have, another tool in the toolbox. In terms of athletics, we did receive additional guidance, and so anytime we have what's considered a close contact within athletics, we're going to be moving with the 14-day quarantine for athletics. Given that the nature of athletics, we won't have close contact will be considered within 6 feet instead of the 3 feet, and within the last 15 minutes of a positive test. So we're going to this highest level mitigation because it's our goal that if we follow these rules right of sanitation, that we can move down to yellow. But it's a community effort indeed.
Will masks be mandatory? And if not, why?
Great question. I don't know if you're familiar, but I will introduce to some and remind to others that our state is under a proviso 1.108, which forbids any organization that is receiving state funds to mandate the mask. However, we highly encourage it, even for our vaccinated. Now, I'll tell you this as a school official: when students come to school, when they get on the buses, they will be required to wear a mask on the school bus. We have school buses that have to take up to 60 elementary school kids on one bus, 50 middle and high school kids on one bus. So we'll provide them with masks when they get on. Also, when they return to go to the nurse's station, not for the medicines or a scraped knee, but if we go to the nurse's station and there's a student with a fever displaying symptoms, they will be required to wear a mask in those cases. And if they're waiting to be picked up because they need for instance, be picked up because they have symptoms, then yes, they will have those masks. So while we're not requiring them in the school, we highly encourage them. I myself will model because when I go to an elementary school or intermediate school where their populations are not eligible for vaccinations, then I will wear my mask.
Okay, Dr. Kelly, this question is for you. In your personal opinion, what is the best mitigation strategy for children under 12 who cannot be vaccinated?
There is good evidence that masks work. I mean, we have biological, I know way back in the beginning, there was some controversy about whether masks work. We know masks are effective. I mean, we've seen it in multiple different settings. So best mitigation measures. Remember, it's no single thing. You know, just as Dr. Ross was saying, you know, it's wearing a mask, keeping a distance, hand washing, sanitizing, you know, all of those things count towards prevention. I will also say, even though we don't have a vaccine for kids under age 12, if you vaccinate around them as much as possible. You know, if you've got older kids, friends, family, church members, you know, clubs, you know, whatever other activities that child participates in, to, you know, encourage those folks to get vaccinated.
Are teachers required to get the vaccine?
So no, teachers are not required. Again, any organization receiving state funds is under that proviso. So that, and we do not require a mask or vaccinations. Again, we encourage that. But I would say this: if you have questions, you know, we have Dr. Kelly here who's done an amazing job of outlining what vaccinations are. But, you know, talk to your doctor, and as I've done mine, talk to the doctor, the person you trust, and listen to their guidance on vaccinations.
Is there any consideration in making the district kickoff meeting all virtual?
Yeah, we've considered that. We provided the option. We looked at how many people are coming and the space. We're going to be under 50% utilization of the space. And so we have plenty of opportunity to be physically distanced. And we have the remote option available, which the majority of staff is taking advantage of. So I think everybody will have enough room in there to be physically distanced, probably more physically distanced than they'll be in the school.
Once the FDA gives full approval to the COVID vaccines, will the district add them to the list of the required vaccines for students? I'm going to ask either Beth Poole or Jane Kelly, Dr. Kelly, if how does that work once the vaccines are approved? Do they automatically go on that list of?
Nothing happens automatically, but that would be discussed. And part of it would be, we would be looking for recommendations from the American Academy of Pediatrics and some other entities. So that would be a possibility, but it is by no means a definite action.
At the high school level, can we ask our students to wear a mask?
Yeah, we can encourage. We can definitely encourage. We can model. I think Dr. Kelly's, recommendation is you can provide these mitigations around the children as well. So we can definitely encourage and those to wear it, and just basically saying I'm encouraging you to wear a mask. Versus a power dynamic of put on your mask, which is what may seem like a requirement. Our ultimate goal is to teach students to make sure that they are able to grow not only academically but social and emotionally. So how we address students during this time is very important. We must be sure not to let fear overcome our faith.
Dr. Kelly, the vaccines are not FDA approved yet. They are only authorized. Is there information that says they are approved?
No, you're correct. They are released under an emergency use authorization. But let me take a moment to explain what's the difference between an EUA and full approval. The difference has to do with the length of time of follow-up with people after phase 3 studies are being done. So for example, for an EUA, the emergency use authorization, you need a minimum of 2 months of follow-up on average among the people who are in the phase 3 study. The phase 3 studies are the ones where you get tens of thousands of people enrolled and they get vaccinated, and then you follow them to see whether the vaccine had the appropriate effect, that it saved them from becoming infected, and you're also looking for safety concerns. The FDA requires at least 6 months of follow-up to do a full approval. They have that now. because those phase 3 studies for Pfizer vaccine, Moderna vaccine, that was back in June and July of 2020. So we certainly have that information. You know, they continue to follow those people. It's called phase 4 of a vaccine study. It's not like you finish phase 3 and you're done. Here we are. We've got some people who were vaccinated a year ago, but the vaccine companies are required to continue to collect information on them to look for any safety concerns. So they have the safety concerns now. Moderna and Pfizer have submitted their paperwork to FDA for the full approval. But I want you to understand that is literally thousands of pages of data. So it's a huge job for them to go through it. I have heard the suggestion that FDA may render their approval decision by this September. But the difference between this EUA and full approval is merely the amount of time of follow-up for safety. They had to do the same studies otherwise.
Thank you. If our state believes that masks are a parent choice, can I, as a parent, choose for my children to be in mask-required classrooms?
We do not have mask-required classrooms. Again, that would be against that proviso. I want to make something very clear. Schools follow the law. We do not make the law. We do not break the law. And so we must follow the law. And so I do not want school leaders, teachers, and school staff to be placed in a place where they're making laws. We're going to follow the guidance as outlined by the South Carolina by DHEC and follow that guidance there. And as that evolves and we learn, we'll pivot. But there are no differentiating between vaccinated classrooms and unvaccinated classrooms, masked classrooms and unmasked classrooms. And we want to make sure that however the student returns to school, that they return to school in a manner that they're accepted and ready to learn.
What specific triggers would have to occur that would cause schools to close? And if so, what are those triggers?
I want to be very careful not to communicate exactly what causes a school to close, because unfortunately, that information has been used to try to close schools. But if you kind of look at the guidance there, you know, when we had H1N1, we had a lot of students absent, a lot of staff absent. When we get to the point that we say we cannot operate a school safely, that is the trigger that begins. But I don't want to give a number out because that number could be used in a way counter to our objectives and vision.
And Dr. Kelly, I believe that this next question you might be able to answer. How do we define low, moderate, and high community spread? Whose definition is DHEC using to, is it the CDC? Is it DHEC?
CDC's.
Okay. What is the district's position on mandatory mask mandate?
Yeah, so we're not going to, again, we're going to follow the guidance and the laws that are provided for us. I think, you know, Proviso 1.108, if you want to look it up, is kind of very clear that we're not in a position to mandate in the schools. However, on the buses, on the school buses, they will be required. In the nurses' stations, they will be required. In the athletic training rooms, they will be required. These are the areas that are outside the purview of that proviso, but they're highly encouraged, especially as we're in code orange. As we move down to greens, you'll see that you know, while they're encouraged, they're not going to be highly encouraged and modeled as we are in orange. And that's the whole purpose of this 5-step system, is so that people understand that a community spread impacts the school. You can't have 3 feet of snow outside and say, all right, well, that doesn't impact the school. It impacts the school. So what happens outside of the school impacts what goes on in the school. And so it is very important that we pay attention to these mitigation strategies and understand that all 9 of them work, and that we have to put that together in order to bring community transmission down.
If an elementary age student has to quarantine, will they be provided with any instruction or handouts for parents to keep the learning going?
That's a great question. Yes, and our teachers are preparing for that as well. And we're looking at improving everything from what's called dual modality, where you're actually teaching face to face, but also serving students in a form like this. We're looking at a quarantine platform that provides better instructional delivery during that. But yes, parents are communicated and teachers are readying their plans just in case students are quarantined. While we're not exactly where we want to be, we're better than where we were when we were surprised with this last year.
Okay, we've got an interesting question here. It says it's somebody who co-runs a school club over at my high school. It is a student-run club. We want to keep our club members safe. As a student-run club who receives no state funding, can a student-run teacher-sponsored club require masking from all members?
Oh, that is a great question. Is that one of our school law students or mock trial students, which is great. However, that purview of that proviso covers after the bail. And so it's you're using the facilities, the district resources. So therefore, it is it will be still under that proviso. However, as a student leader, it's important that you're here, that you're learning from the experts in the field like Dr. Kelly. And I would encourage you to, it's one thing to tell somebody to do it. It's another thing to inspire them to do it. And I think you use this information where you actually make the change in their heart, where they say, you know what, I believe in what you're saying, and I'm going to mask to protect myself and others.
And we've gotten a number of questions, and I know that you already answered it, but maybe you could quickly just recap what you let everybody know about the option of having mask classrooms versus no mask classrooms, separating the children by that classification. Can you just give that brief answer again, just for the people that might not have heard it?
Yeah, and I think what's important is we must not forget our common goal, our first goal. Our first obligation is to build the children academically and social emotionally. And when you start to separate students by anything, we do it in grade and in courses, but when you do it by characteristics, we start adding other issues. And so understand why the American Pediatric Association suggested that kids are going into school. It's for social development and how important that is to their psychological development, to their long-term mental health. And so when you say you're in this room because of you're vaccinated, and you're in this room because you're not vaccinated, you're in this room because you wear a mask, and you're in this room because you're not wearing a mask, that starts to provide risks that I don't see any benefits can outweigh.
And this is somebody who's looking maybe for an educated opinion from Dr. Kelly. She's got children that are currently virtual, and I think that they did virtual learning last year as well. She's wondering if people continue not to vaccinate and masks aren't required in schools, when do you think my children will be able to safely return to school in person? Do you have an educated guess when maybe this will go away?
What I really need is a crystal ball to answer that question, but let's try and approach it from a couple of different points of view. Vaccine is how we get out of this pandemic. That would be the most efficient way. Herd immunity didn't eradicate polio. Herd immunity didn't eradicate smallpox. It was vaccination. So vaccine is how we get out of this. So I'm hoping that people will come around and consider vaccination. Not everyone has to be vaccinated to stop the chain of transmission, but you definitely need a higher level than what we have here in South Carolina. The other factor has to do with the variants. Right now, the Delta variant spreads very quickly, very efficiently, but vaccine works for it. What if we get other variants that evolve? That's one of the challenges that, viruses mutate. That's what they do for a living. That's why the flu is different every year. If we start getting a new variant that eludes or evades vaccine, that's another really scary scenario. But I know you're looking for something a little bit more reassuring. Let me give you some reassuring things. It is true that what we know about durability of immunity with vaccine is that these vaccines are really good and they last a long time. I mean, we haven't had vaccine out long enough to know will it last for years. We don't know that yet. But from what we can say, from the people who have gotten vaccinated a year ago, they still have antibody levels. They still have memory T cells and B cells. There are other things in your immune system besides antibodies. Everybody's talking about antibodies. There are other things to fight off infection. We have excellent evidence that says these vaccines do work. So we'll have a certain proportion of the population that's very protected. What happens to those people who don't get vaccinated? Well, eventually, if you don't get vaccinated, I feel pretty confident that unless you really live as a hermit and never go outside, eventually you're going to get infected. And that will give you some immunity. So I don't think that COVID is ever going to go away completely, honestly. I don't think that we're going to eradicate it. I think it's going to be something that comes around yearly, but we can get it under control. As long as we can get it under control so that we don't have people having serious illness, hospitalization, and deaths. That's, if I had to say when we might reach that point, I'm sorry, I'm not being very helpful. I can't say until we know what happens with the number of vaccinations and with the emergence of any other variants.
Will students that are not vaccinated be required to provide weekly COVID test results?
No, students who are, and again, we do not know who is vaccinated or who is not vaccinated. We know when that information is provided to us. For instance, if a student is considered a close contact through contact tracing and they're within that 3-foot limit of a confirmed positive, then they will be told to quarantine. If the student at that time says that they have been vaccinated and provides that information at that time, then they will forego the quarantine. That, as well as students who have positive antigen tests, or I believe it's the PCR test, will forego the quarantine. And that's how we'll get that information.
Okay. Are we starting the year with any school nurse vacancies, and are we providing any additional staffing for our school nurses who will likely face very high COVID caseloads to manage?
That's a great question. I don't want to speak on something where I may have ignorance. It's my understanding that we are fully staffed in the nurses with floating nurses. And also, I just think about, we're adults, and think about the fear, the level of anxiety that we're facing. We have children, and they're hearing this, they're going through this as well. So in all of our schools, we'll have a crisis response team for the first 2 weeks, so that kids who are coming and they're scared, they're worried, that there's somebody there trained to be able to address that trauma. Our community has gone through collective trauma. And so, yes, while the masks and vaccinations and the other 7 mitigations are important, so is that social emotional health, that fear, that anxiety that's sitting on the heart of that child. And so we'll have our nurses backed up, but so as well as our school counselors with crisis intervention specialists in all the schools.
Okay. Will children elementary age, especially if they have to quarantine, will they have the option to log into the class virtually?
So yeah, that becomes dual modality at that point. We're trying to improve that. I don't want to say consistently across the board that we'll have that. It may be the quarantine instructional packets by and large, and in some cases we'll get to dual modality. If you're not aware that we are required to pay teachers extra if they engage in dual modality because how difficult it is to deliver instruction with students face-to-face and with students in a virtual format. And so we're hastily drawing up those procedures on how we track those hours and pay that staff.
Is there a law against a teacher informing parents of their vaccination status?
Oh, no, you can voluntarily provide that information. I know some districts are asking, and you can provide that information. I provide it to anyone. I'm vaccinated. My family, eligible family members are vaccinated, so you can provide it. Us providing, especially identifying anyone without their permission, could be a clear violation of FERPA. So we want to make sure that we're in a position where we're following the law in that case.
And we've got a question about contact tracing and how the school is communicating this information.
Yeah, so contact tracing is done by our nurses. They can, nurse Stana can give more detailed on the actual procedures. And to the person who asked, our nurses fully staffed and supported might be a nurse in the district because they understand just how much work it requires. It's one of the reasons that we limit field trips, or we do not allow field trips during Orange. Because as you send that student out, the contact tracing just balloons to areas where we can't have it. But if you're in that 3-foot bubble of that person, then we're going to contact trace you.
Okay. Do our schools have adequate supplies of masks that can be handed out to students?
Yes, and we're going to have them on the buses and the nurse training rooms. I think the biggest thing is, how knowing how COVID affects you, right? Through the eyes, the nose, and the mouth, and just constantly washing your hands, constantly sanitizing your hands. If there's any cuts or anything, constantly addressing that. So just kind of knowing how the virus works. You would be amazed that just through cleaning, through keeping your hands sanitized, keeping them out of the face, wearing the mask, getting the vaccinations, having the ventilations, just understanding how we're replacing air in our buildings. If there's opportunities to have the class outside, having the class outside. There's a lot of things that we can do in the fight against the spread of COVID-19.
And I believe you've already kind of touched on this answer, but you can just reiterate. They were wondering how our administrators, teachers, and staff are being coached to encourage students to wear masks.
Yes, I think just going through our guidance that we have here is just really important to make sure that our principals and administrators, they help develop this. So this is not a plan that they were just received and that they, had. This is a plan that they helped create. And there's just something in, coaching something that So being able to create that and to be a part of that, I think is what allows them to be prepared to teach it to their staff.
Will there be some more elementary virtual class options that are opening?
Good question. I do not know at this time. I will need to check with staff in the morning. That's something we can record as a question to get back to the community.
And Dr. Kelly, this might be something that you might have some knowledge on. We've got a question asking if the FDA full approval of the Pfizer vaccine is it expected within the next few weeks? Do you know that?
It is expected that FDA will make a decision in the next few weeks. And from everything that I have read, I would think that they would approve it.
Okay. Let me see here. Excuse me. There's some comments, so I'm just going through those. Has there been any budget allotted to increase virtual support and teachers? I guess any new money given or budgeted to increase virtual support and maybe add virtual teachers?
I think we have to be very careful with ESSER because was considered one-time money. Once this money is gone in 3 years, you're not able to replenish that. Hiring staff that are expected to be paid every year off of one-term monies would not be sufficient. However, I'm just extremely proud to of what we are doing to hire and to make sure that our virtual academy, which is called Five, is staffed and ready to go. And we encourage, and we will need this. So we have a substitute service, ESS. You can go on our website, sign up if you would like to be a substitute teacher. We know that we are definitely in need of staff. So we have people contacting us daily. And so if you are certainly interested in serving as a substitute or helping us in the system, you can go to our HR website and sign up for substitute services through ESS.
Okay, and I actually think I can answer this next question, but Dr. Ross, feel free to chime in. They're asking, and I believe they have the wrong federal agency, but it says, will the FDA cover the cost of meals for the school year as they did in 2020? And yes, the Department of Agriculture will be providing free meals to children, breakfast and lunch, like they did last year for students. We are still asking, our student nutrition team is still asking for parents, if they do qualify for that free and reduced lunch, to go ahead and fill out that paperwork because it gives them some other benefits that they are eligible for. So they want to still fill that information out. And all of that information is on our website. If you go to lexrich5.org, you will find that. And there's possibly is in the need to know section, and it's also in the press release section. But those meals for students, like last year, breakfast and lunch, will be provided for free to students. All right, let me get to the next question. As of last week's parents of kids interested in playing sports were required to sign a document waiving liability if their child contracts COVID, regardless of any negligence by the district. On the form, it outlines steps that the schools and representatives must take and require, including wearing masks, temperature checks, etc. With optional masks now and the reduction of other safety measures to be taken by schools, is this form still required, or has the form or school expectations changed?
I remember the form. I think I need to look at it again. Of course, if that form came out prior to the proviso, then yes, it would need some adjusting. Just understand, though, that the South Carolina High School League has provided additional guidance, and which talks about screening, which talks about how we quarantine, moving to the 14-day, prohibiting the intervention. But it also talks about making sure that we ensure that our athletes are separated as much as possible from those in the stands, and to protect them as well.
Okay. If a student is out for quarantine, does that go towards the days missed, even if the teacher gives them schoolwork while out?
Yes. So that's a great question. And, when we're asking them to quarantine, that's us asking them to quarantine. We still have seat time requirements. And so the responsibility is that they turn in their work and they show up to where they're asked to to show up, and that they get that work in on time. So they're still required to do that work.
Okay. Okay, and this is a question that I feel like Dr. Kelly can address. COVID has multiple variants, and if the mortality rate is down to under 400 nationwide, at what number will this be treated as any other communicable disease? We don't seem to have a goal and treat it in the same regard as the flu.
So I would consider COVID-19 as very different from influenza or the flu. On a really bad flu year, for example, H1N1 in 2009, 2010, there were 60,000 deaths from influenza. In the past year with COVID, there have been over 600,000, 10 times as many deaths. So COVID is a very different viral illness, a much more severe viral illness than influenza. So it would be a hopeful thing if we got to the point where COVID could be treated like influenza. That is possible. I don't want to be all doom and gloom here. Masks do work, distancing works. The schools did a great job last year in preventing secondary spread. So it can happen again this year too, even with Delta, even though the Delta variant's more transmissible, it spreads more easily. It can be done if you follow all those mitigation measures that were mentioned, even if people don't vaccinate. But vaccine will help a lot more. When will we be able to treat COVID like we treat the flu? Well, we might get there, but we would need a lot more people vaccinated. I'm not sure if that's completely addressing that question. Let me scroll back up and look at that question. I mean, there were 400, fewer than 400 pediatric deaths, but it's true that most of the deaths were among older adults, but not all of them. Some were young adults, middle-aged adults. We are having some deaths among children and teenagers. So, sorry, I'm still looking back for that question. There it is. At what number will this be treated as other communicable diseases? When we have the control and we have fewer hospitalizations and deaths. Right now in South Carolina, some of our intensive care units are full. The pediatric intensive care unit, Children's Hospital, the ICU is full. So they're having to transfer kids from one hospital to another. And some of the states that are in worse shape than we are, they're transferring kids out of state for care. So we don't want to get in that point. We want to, stop transmission where we are now. So multiple variants, mortality rate under 400 nationwide, but that's for children. I'm still not quite sure what that person is asking. I might suggest if you would like to email me, I put my email in the chat box. Maybe we can clarify this in a different conversation.
Okay, thank you, Dr. Kelly. Will you please outline the course of action if a classmate comes in close contact, who quarantines and for how long?
I could take that one. So there's a difference between vaccinated and not vaccinated, and a difference between fully vaccinated and not fully vaccinated. Now, the school cannot ask a teacher or a student to reveal whether they're vaccinated or not. But the other way around, the student could reveal that they're vaccinated, or parent and student could reveal it. So, for example, a child is a close contact of someone who is a positive case. By that definition, we mean at least 15 minutes within 3 feet of the case of the infected student. If it's a teacher who is infected, it's at least within 6 feet of the teacher. If the child is fully vaccinated, meaning 2 weeks after that second dose of Pfizer, they do not need to quarantine if they have no symptoms. They're supposed to wear a mask for 2 weeks to protect others, but they do not need to quarantine if they have no symptoms. If they have symptoms, that's a different story. Just like anybody else, you would want to keep them home, test them until you know that they have a negative COVID test. An unvaccinated child, though, or a child who's maybe only had 1 dose of vaccine, they're not fully vaccinated. It's the same quarantine as it was last year, 14 days quarantine out of school. And there are some other options for ending quarantine a little earlier at day 7 or at day 10, but that's up to individual school districts making decisions about what their policies are for that. But there's a huge difference between vaccinated and not in terms of quarantine.
Perfect. There was a question that is asking, we are understanding that Dr. Ross has mentioned that we will, when we start back school, will be on level orange, and that has an upper limit of 15%. They're wondering what is the current percent positive rate right now, and should we be opening in red?
Yeah, so red is means buildings are closed, so we wouldn't open in red. Our dashboard will start on Monday, and we will have the old dashboard that we had last year, and we will be moving to a more color-coded dashboard using the Tableau system. And so you will see by school level. And one of the reasons that we're using this is it allows us to see what schools that we're seeing that some of these mitigations are working. As we increase the fear, we increase the faith to overcome that. We have the ability to fight this the spread of COVID-19. We just need to put it in place and give it a chance. And if we haven't earned that trust, I totally understand. But we're working hard to make sure that we're welcoming our students back. Understand when students test positive or we're going to quarantine, this is just things that we're doing to try to stop that spread. But we're going to do everything in our power to make sure that students are safe when they arrive. But the color system to go into orange is to get the highest mitigation level as possible. Put those strategies in place, all 9 of them. And as we see the numbers go down or stabilize, then maybe we can go to yellow.
And how will parents be contacted, and how quickly if their child is directly exposed to an infected person?
A great question. The speed in which that would happen, it will happen that day because we won't close the day without letting you know. But as soon as that positive case is notified, we begin the calls. That's happened already in my family with summer camp. So we begin those calls to make sure that you are aware. Of course, you won't know who the student was that tested positive, but you will know that your child has been in close contact and has to quarantine.
Okay, we've got another question. She says, I understand that we need to put children first, but what are we doing for our faculty and staff? Is there a reason why the district is not providing leave days if quarantine is required?
So we're investigating that. We believe that vaccination is available to our staff, but we recognize that staff have children who are in that unprotected or that unvaccinated population. And as a result, we are investigating, and this is a matter that I do have to take to the board for approval because of the funds necessary to have a option for COVID leave when it's related to a child.
And this, what is the current local COVID positive percentage rate?
Dr. Kelly, would you have that information?
I do not.
Yeah, I mean,
it'll be on our website, but I don't know it offhand.
I would ask that you go to the South Carolina DHEC has a website. You go to COVID-19, their dashboard. Under their dashboard, click on cases. If you go to the cases link, you will see that you can pull up your entire zip code. So you put in your county. We have Lexington and Richland County, and I can go to our zip codes. And I can tell you that if you look at our zip codes from the top of our district, zip code 29063, we're high spread. You go to the east part of our district, zip code 29210, we're at high spread. So from Piney Woods to Seven Oaks, we have high spread by zip code. So you can go pull your information for your county and for your zip code to see spread data.
And Dr. Ross, last year we had funds that were provided for mental health services in our schools. Will those funds continue? And is there a certified mental health counselor in every school to provide these services for our children?
Yeah, I think the board and administration last year did a great job of recommending an increase of social workers for mental health. They put together a great plan that I benefit from, or I don't benefit, but the students benefit from. So we're just building on that plan. Dr. Harris and his team are putting that in place. Unfortunately, we are not at the ratios that we want to be with mental health, school counseling. We're trying to target 1 to 250 as the dream, but in some cases, you have one for every 2 or 3 schools. That's a reality that we face on the ground. So while we've increased the number of social workers and the social emotional health program, we still have a long way to go.
For District 5 employees with children in the district, if our child is quarantined, are we required to take our sick days to accommodate? Is working from home still not an option in those instances?
I'm going to be very cautious and let HR respond to that. We will gather that question. One of the things that we're investigating at, and we have not brought this before the board, is to make sure that we have for staff whose children who are especially under 12 who have to quarantine, that we have COVID leave for them. So we're investigating that to take to the board for approval.
Will KN95 masks be provided by the district since they are more reliable than the procedural mask and cloth mask?
I think we provide those blue medical masks right now. I don't know if we have the KN95. Dr. Kelly, what's your thoughts on what masks are most effective?
The surgical masks, or those blue masks that you're talking about, or a 2-layer cloth mask. Both of those, as long as they're fitted closely, as long as they're not pooching out at your cheeks or not down below your nose, seriously, that they are highly effective. The deal with the N95 or the KN95 masks is they have to be fit tested to be more effective. They're not more effective because somehow the material is better. It's because it gets fitted precisely to your face. So unless you have fit testing, they don't really provide better coverage. You can get good coverage with a 2-layer cloth mask or those surgical masks.
Okay, please cover procedures for quarantining classrooms. What warrants it? If a student has close contact, then comes to school, what happens?
Good. So the quarantining classrooms I'm not familiar with. It's only, we're looking at the close contacts with the positive cases. And so one of the reasons that in Orange we start moving to physically distancing is to limit how many close contacts you have within a specific period of time. So it's the time of exposure and the distance. Dr. Kelly, I'd like you to explain a little bit more about what we consider close contact and why.
Sure. So close contact definition is within 3 feet for a cumulative minimum of 15 minutes. So if you're like together for 5 minutes here and 10 minutes there, that adds up to 15 minutes. That makes a close contact. Now, CDC and DHEC last year said close contact was within 6 feet. That is still true for adults. So there's 6 feet between an adult and a child, or adult and adult. Within 6 feet is a close contact. It's different for kids. Why is it different for kids? Why do we make that recommendation? It's based on studies out of Europe. In Europe, they set the kids a meter apart. A meter is 39 inches, just a little bit more than 3 feet. So we have gone with that, recognizing that we think that risk level is appropriate, and it certainly makes it easier on the schools in terms of distancing, if 3 feet is required rather than 6. So again, to repeat, close contact is different for adults than it is for school-age children. For school-age children, it's 3 feet, closer than 3 feet, more than 15 minutes.
Okay, we've got a question asking if there will be any, have we considered any legal action against the governor's order about not requiring the mask, since dozens of districts around the country have disregarded their governor mask mandate bans? And considering that, and the CDC and the American Academy of Pediatrics have put out guidance that students should be wearing masks at school. Is there a reason why we're listening to the governor, and is anybody knows considering any legal action against the order?
We're not considering any legal action. School will be starting. We wouldn't have, I don't think, any success moving forward, any legal actions, and we need to put our resources into making sure, our time, effort, and energy into making sure we have these mitigation strategies up and running.
And this is just, I think, a clarification. When you speak of the positivity rate being based on the county, are you referring to the positivity rates in the geographical counties of Lexrich 5 or the student population numbers of Lexrich 5?
We look at the community spread of the county. We just feel that people will be everywhere, and they move throughout the counties. They move everywhere throughout the county, across many jurisdictions. So we look at the county.
Okay. It says in South Carolina, anyone 16 or older can independently choose to vaccinate. Will our school nurses be allowed to provide accurate information about the vaccine to students, especially those who are old enough by law to make their own decision?
I'm sorry, what was that again?
Basically, I think she's wondering if our school nurses will be allowed to provide accurate information about the vaccine to students in our population that are 16 and older that are allowed to get the vaccine without their parents' permission.
This is a family decision. And so we're going to let family, we're having forums like this to inform our community, inform our parents. We put this guidance out on our website, but that's a decision between a physician and the family, and the parent and the child. We'll provide the information and let the family make the decision.
Okay. And I think we've touched on this as well. What's the current leave policy for teachers forced to quarantine due to student contact? Is it using their personal days, unpaid leave, sick days?
Yeah. So right now, as we're still developing that, our leave policy has come to an end. Our COVID leave bank has come to an end, but we are investigating what we will do in terms of those who have what's called they have quarantines for those who are related to them. So for their child, for instance, that they have to stay home for, we're investigating how we will do the leave bank for them.
Will classrooms continue to be set up with social distancing in mind?
Yeah, so in Orange, we look at as much as possible moving to physically distanced classrooms and being cognizant of everything that we need to do in order to stop the spread.
Is there anything that parents can do to help support teachers during this stressful time?
I thank you for that. I think, the more we can talk about what we can do as a community versus what you can do as a community, the better we are. Most of our educators are just that. They come to teach the state standards, to develop kids socially, emotionally, and really what they get is accused of not being protecting kids or putting them into a situation where they're not comfortable. But asking that teacher, how can I help you? What do you need? Our board gave teachers an extra $100 in supplies to just make sure that anything they needed or whatever they could get for their classes, that they were able to get so that they feel ready on the first day. So we're going to truly be a community we can either A, point the finger, or B, look at what we can do to help the entire community. And so those who are asking how we can help, those are the voices I'm listening to.
Okay, and I'm just looking at the time. It says it's 7:29 right now. So I don't know if you want to wrap up and just let everybody know we will get all of these, capture all of these questions, and they can always send us emails. We have a reentry email. It's reentry, REENTRY @lexrich5.org. And if there's a question that you have that you would like answered, that email is monitored and we can find answers to any questions that you may have. Dr. Ross, I'll hand it back over to you.
Laura, thank you so much. You did a great job of handling all of that. Jenny Garris, we thank you. And to Marty Rawls, I guess no one had any extra questions, but thank you so much for being on, Beth Poore. I really appreciate your partnership in getting this taken care of. And to Dr. Jane Kelly, thank you for your expertise. And to the community, we thank you for being here tonight. We apologize. We know we couldn't get everybody on who wanted to watch. We will post this and definitely have more of these community forums so that we can really hear from you on a wide range of questions. We know we have a lot of work to do. We know we're not perfect, but with your help, and again, with your help, we can get better. And so I thank you for those who want to help us. Because we have that same goal to help our children. So with that, we will end for tonight, and I look forward to seeing you at our next community forum. Thank you so much.